I'm going to take you through today a brief journey about what is the role of meditation as a medication in terms of heart disease. So since I'm a cardiologist, I'm dealing with heart disease for several years now, and I have seen very closely how nowadays we are seeing the overlap of these esoteric practices which patients are incorporating more and more in their treatment modalities. Similarly, now scientifically also we have started using these practices for the well-being of the patients. So this will be a brief presentation, I should say, of around 30 minutes. And if time permits, after that, we will have a presentation, question answer session. And if you all are willing, we'll have a brief session of heartfulness meditation for 10-15 minutes.
Sir, we are very much willing for meditation. That is my first priority.
That would be very
people
good.
should get taste of meditation.
Yes. So let's talk about meditation as a treatment modality, as a preventive tool, and the effect of meditation on health. So as I have been introduced briefly, I come from a purely allopathic medicine background, but I have been practicing heartfulness meditation now for more than 20 years. Soon after my MBBS, I was very, very fortunate to have come across this system. And since then, I have been practicing this system. And it is only because of the tremendous benefits I got with the use of medicine that I was able to incorporate this practice in my daily routine. And it has helped me not only in my professional growth, in my practice, but as they say in medicine, physician heal thyself. It has helped me remain balanced, navigate the ups and downs of life, face tough situations in life, and come out with ease and to continue to practice my profession with rigor and zeal that we all are supposed to do. So that's why I believe that it is not a thing which should be considered unscientific, opposed to what we are taught in allopathic medicine, but it is something which we should incorporate in our daily life, and it helps us do better whatever we are doing as a person, whatever job we are doing, whatever work we do. A meditative person is able to do that job better. So let's move on with the topic. Holistic health was one of the titles. So what is holistic health? So the greatest problem of the modern medicine is the super speciality approach. And I am a prime example. Being a cardiologist, I am not expected to know anything about orthopedics or neurology or gastroenterology because I have been trained only in one small part of the body, which is the heart. So this has been the greatest mistake, according to the great philosopher Plato, that the greatest mistake in the treatment of diseases is that there are physicians for the body and physicians for the soul, although the two cannot be separated. This was said centuries ago. Similarly, Socrates had said that a part cannot be well unless the whole is well. And we see dissatisfied patients every day. We are giving them the best of treatments available, but yet the patient is not well. He is not feeling good. You have put the organ perfectly all right, but the feeling of wellness is not there. And that cannot be there unless you balance the body-mind medicine. So this segregation of body and spiritual aspects is not correct. And that is why modern medicine is failing. It is possible to feel good, feel complete, feel wholesome, only if we have the coming together of the body, mind, and soul. So meditation, if we look at a holistic health approach, helps us do that. There are enough research evidences which show that meditation has an effect on the body in terms of helping us lose weight, improve metabolism, boosts immunity, improves quality of sleep, reduces aging. But very powerful effect of meditation is already known on the mind. Reduces stress, improves the sense of well-being, makes the people around also start feeling happier. If you are a meditator in your house, you will notice that other people also get benefited by this. This does not happen by any other drug. You take the drug, you get better, but the effect of meditation percolates to your surroundings also. And this is something spiritual aspects which science can never prove. Meditation helps us connect to our source, which is the source of life in us. And when we are leading our lives connected to our source, we are balanced and a feeling of health comes to us. As Dr. Ranjan was pointing out, non-communicable diseases are the leading killers of our times, and it is a shame on the modern society that it is not any bacteria or virus or a parasite which is causing death. It is not dengue, malaria, or even COVID, which took as many deaths as these lifestyle diseases are taking, led by cardiovascular disease, number one, number two being cancer, then diabetes, liver, and lung disorders. And this is a graph from 215, and the data from WHO 212 was 2 million lesser. So the numbers are only increasing by the day. So lifestyle diseases means these are the diseases which are directly a result of our faulty lifestyle. So we may claim to be very intelligent creatures on the planet, but we are the only creatures who have created such a unhealthy lifestyle that it is causing our own destruction. No aliens are responsible for this. No neighboring country is doing this. It is our own unhealthy ways of living which are causing cardiovascular disease and cancers. So all these risk factors are common to these non-communicable diseases. What are the risk factors? Faulty diet, consumption of alcohol, tobacco products, physical inactivity, which results also in overweight or obesity, and raised blood sugar, blood pressure, and cholesterol. So these are simple lifestyle related risk factors, which are the cause of number one killers today: cardiovascular disease, cancers, diabetes, lung disease. But the golden, as we say, silver lining is that 80% of premature heart disease, stroke, and diabetes can be prevented. And that is why these kind of talks, presentations, awareness generation, because this is an eminently preventable disease. I'll talk today about cardiovascular disease only, because being a cardiologist, I am expected to do that. The commonest cause of cardiovascular disease is not a single agent. It is a multifactorial disease caused by, now we know, these 9 risk factors explain 90% of the occurrence of heart attacks in the world. It is not that Indians are more genetically prone or more genetically predisposed, and God has been unkind to us in giving us more severe heart disease. We have more diffuse vessels, small caliber vessels, very difficult to do interventions, bypass success rates are less. All this is not because of any genetic nature, but because of our faulty lifestyle. So these 9 risk factors are known as modifiable and non-modifiable. The 2 bottom risk factors, age and family history, are non-modifiable, while the 7 risk factors that you see are lifestyle related and easily modifiable. So we call them the modifiable risk factors. So 7 out of 9 are in our control. And there are studies which show that if we control these risk factors, the risk of heart disease can be reduced to a large extent. So where does meditation come into all this? So I will be showing you briefly in one slide each risk factors, how each of these risk factors has been shown to be impacted by meditation. We are looking at meditation as a public health tool because this is something which can be applied to large number of people. Some systems of meditation, like which I have been practicing, is a heartfulness practice, is quite practical, quite easily applicable because it is accessible to all. You can practice this anywhere in the comfort of your home. You can go to special places. You can do it in a train, in a bus, in your offices. Any time of the day, it can be done. And it is known to be effective. You feel the effects within a few days of starting the practice. Above all, it is quite simple to do. Even village people, completely illiterate people are able to do these systems, and we have millions of people in rural areas today practicing heartfulness meditation. Besides, number one advantage, we all want free healthcare. So this heartfulness way, the greatest advantage is that it is completely free of cost for all the spiritual services offered by the Heartfulness Institutes. No fee is charged at any point of time. So it is becoming very popular, spreading across the world, now present in 165 plus countries of the world. So all these advantages, I pitch this as an approach to wellness, as an approach to overall health. So let's see how we stand today in terms of meditation being talked about as a tool for risk reduction of cardiovascular disease. This is from American Heart Association statement in 2017. Looking at the evidence, there were so many studies on transcendental meditation, different types, already available with American Heart Association. So they gave a recommendation of class 2B and said that all doctors can talk about meditation as a tool for reducing blood pressure to our patients. We all know that we talk about salt restriction, physical activity, a particular type of diet rich in vegetables and fruits for reducing blood pressure. But now evidence with meditation is of the similar level, and we should talk about meditation to all our patients as a tool to prevent and reduce the severity of blood pressure along with drugs wherever required. Cigarette smoking, a very difficult to quit habit. And we see patients, all of us as doctors, who struggle to quit smoking. They try very hard, not able to quit smoking. Where is the problem? The problem is in the brain circuits. We want to break these habits where habit circuits have formed in the brain. And no drug can go there and do that for us. It is only by changing our neural networks, changing our behavior, improving our willpower. And meditation is able to do this in a very, very effective and 100% safe way. So there's a small study with mindfulness for 2 weeks, just 5 hours exposure to meditation practice. 60% of people were able to quit smoking, which is a remarkable result for any practice in a very, very safe way. Coming to psychosocial stress. If you saw, stress was also a risk factor for myocardial infarction, and it is not I haven't talked about because we often think that this is unscientific, like stress, how can it be causing a heart attack? But it is known because there is clear evidence, and that is why it is listed as one of the 7 risk factors. There is clear demonstration of cause and effect relationship. That is why it has been chosen as a risk factor. We don't label anything as a risk factor unless there is clear evidence linking it directly as a causative agent. So for stress, the evidence is robust. And before COVID also, we have been using the term of silent pandemic for stress. So this is silently killing our population in many different ways. And there is not any simple, straightforward diagnostic test which people can do and correlate their numbers with laboratory values to say कि मेरे को mild stress है, मुझे moderate stress है, मुझे severe stress है, पहले से मेरा stress इतना कम हो गया है. There is no way. Even as doctors, we often miss out of a patient having underlying stress while presenting to us in a different way of heart attack or high blood pressure or lack of sleep or in different gastric troubles even. So stress is a very dangerous risk factor, causes many, many diseases, increasing its number by the day. It is very important for us to recognize this very powerful risk factor. We call it the silent killer. And India has a distinction, a shameful distinction of having the highest number of student suicides in the world. This means that our student community is under so much of stress. Our youngsters are under so much of stress that they often have to end their lives, which is a very sad thing in a way, because we are putting them as a society under, leaving them with no option but to end their lives. For example, 11% of the US teenagers are suffering from depression. In spite of good economic progress, there's no dearth of economic progress in these countries, financially very well off, but that is no solution to stress, we have learned. We also know that we were more happy in the 1929 and in the World War era than we are today, in spite of all the gadgets that we have, in spite of all the new avenues of progress we have generated for ourselves. So this clearly proves that happiness is not outside. Happiness and leading a healthy life is not depending on economic progress and gizmos and gadgets. It is a state of being which comes from inside. So for the purpose of study, we often talk about stress in terms of defining stress, and we have to divide it into four commonly used types: work stress, domestic stress, financial stress, stress related to life events. And all these are interrelated. If you are stressful at home, you will bring that stress to workplace. You will not be able to focus on your work. You will not be a good employee for your workplace. Financial stress, all of us have to go through different points of time. So we need to learn to handle these different stresses and be able to live a healthy life. So stress cannot be taken very lightly. It is not only a risk factor for a myocardial infarction, as I just showed, it is a risk factor for many, many other common problems: headache, anxiety, depression, substance abuse. चलो stress है, बाहर में चलते हैं, stress कम हो जाएगा, vacation पे चलते हैं, spend a few million and come back again in the same stressful situation. So these are not durable solutions for stress. Very commonly, our patient complained of GI disturbances, irrelevant diarrhea, constipation as a habit. And most often, underlying problem is psychosocial stress in these situations. Hypertension in young people, I'm seeing very commonly coming to us who have night shifts, not able to sleep properly. There is underlying stress which causes high blood pressure also. So, in this powerful risk factor of stress, what is the evidence of meditation? So you will be happy to know that meditation is the #1 tool for stress management the world over. And it was a compilation of, this is a very good study, Journal of American Medical Association publication, compilation of 47 randomized controlled trials, already looking at meditation and its effect on depression. They found that the effect size of meditation to the tune of around 30% was exactly similar to all the antidepressant drugs put together. So it is as effective as all antidepressant drugs, yet has no side effect which we see with antidepressant drugs, which are very, very common. They have addiction liability, abuse potential, you get tolerant to lower doses, you have to continuously go on increasing the doses, etc., etc. And none of these problems is there with meditation, yet equally effective. So we also did a study with the Heartfulness Institute in a hospital setting in US, and we demonstrated that just 12 weeks of heartfulness practices when given to a group, and we compared it to a group who was not given these practices, doctors, nurses, paramedics, we found that they reported significant increase in positive emotions and a significant decrease in negative emotions like fear, irritability, anxiety, cynicism. And very importantly, a landmark demonstration that those who meditated, their telomere length increased. So this is a part of the chromosome we all know, which is increasingly length means it correlates with improved longevity, better age, and more disease-free survival. So those who meditated just for 12 weeks had a longer telomere length, and this was a published study with heartfulness. Another evidence, if you go to the website and Mayo Clinic website, one of the top medical institutes of the world, if you type meditation, you will find it listed under the headings of tests and procedures. Along with the CBCs and lipid profiles, you will find meditation as a test and a procedure listed in the website of Mayo Clinic. And they define meditation as a simple, fast way to reduce stress. And they counsel their patients about meditation. They have a place in the hospital premises where patients, attendants, anybody can go and meditate. So this is where the West has given the recognition to meditation as a tool for bringing down stress and for overall health. Another compilation from European Journal of Preventive Cardiology, 2014, different studies on yoga, 37 randomized controlled trials put together, demonstrating that there is an improvement in body mass index significantly, reduction in blood pressure, 5 and 2 systolic diastolic is as good as any antihypertensive drugs. Reduction in even LDL cholesterol, improvement in sugar values, and no difference in going to a gym and doing yoga in terms of weight loss. So very powerful evidence from across the world in good quality international publication. Going across the continents, this is a publication from Africa, and they talk about the role of meditation in rehabilitation after a patient has had a bypass surgery, angioplasty, stroke, MI. They offered meditation practice along with the conventional diet and physical exercise that we discuss with all our patients. So those who were given the practice of meditation, at the end of 5 years follow-up, there was 48% reduction in the risk of primary endpoint. And what was the primary endpoint? It was the powerful composite endpoint of all-cause death, myocardial infarction, or stroke. So 48% less occurrence of death, MI, or stroke in patients who were given meditation practice as a follow-up tool in their rehab. So if we incorporate this in our rehabilitation programs, it is going to have a powerful impact on the patient in terms of very hard endpoints. So that is why now American Heart Association gave a scientific statement, including meditation as a tool for cardiovascular risk reduction. It has been already 5 years when this statement has been given. So we can talk about, without any hesitation, in a very scientific language to all our patients, discuss meditation, recommend it as a tool for reducing cardiovascular risk. So not only in cardiovascular disease, and the role through stress management, through the effects of meditation is generally coming through the mind. If you look at it, the major axis is the sympatho-parasympatho axis through the mind, but also directly some systems like heartfulness directly act through different pathways in producing powerful early effects. When we start practice, within no time we start seeing the effects, and there is an effect on the brain waves also. So when we meditate, it is known that we go into alpha, theta, and delta waveform. And those who are regularly meditating, even in the daytime, they remain in a very calm and relaxed way. If you meet some people who are meditating, you will find whatever be the situation, they are able to maintain their calm composure because they are able to remain in an alpha state. And if our students, all of us working people also are able to remain in alpha state, we are more receptive. We are able to absorb more information. We are able to retain information better and learn better, rather than being very concentrated, being alert all the time, which is good, gives us focus, but also gives us mental fatigue, tiredness, and we are not able to learn better in this state of mind. So it is better to be in alpha. And during meditation, we go into deep sleep-like states called the theta and delta states. And some of the avid meditators are known to remain even in theta state and delta state during their waking period, which is as deeply relaxing as it is during deep sleep. A very important thing to note is that this is the state when you get intuitions and when you get insights. So if we have problems, if you want to solve our problems, different problems related to life, we go into deep meditation and often we come out with clear solutions. This is because in this deeply relaxed state, we get insights and intuitive information which no logical analysis or no discussions will ever be able to give us. So a very powerful tool, meditation. It is not just closing your eyes and feeling good after that. It has a residual effect also, and it has a powerful effect on the well-being of the brain. A very important health hazard that we are seeing nowadays as doctors is lack of sleep. Almost nobody is able to sleep properly, be it the senior citizens, our parents' generation, or youngsters, or people with shift workers. All of us are not able to sleep properly, sleep deeply. And this has a great impact on overall health. It is now known that meditation stimulates sleep, helps us sleep better. And it is recorded that sleep, as I just discussed, the theta waveform and delta waveform increase, relaxation response is produced, and you can lapse into sleep very easily. Also, meditators have a higher level of melatonin, the sleeping hormone. And there are a lot of studies from the Heartfulness Institute also. If you log in Google Heartfulness and sleep, you will find 4 5 studies done in the US showing the effect of heartfulness meditation on reducing the insomnia severity index, helping people sleep earlier. Even doctors who have very irregular day-night schedule are able to sleep better when they incorporate meditation in their daily lifestyle. And this is a functional MRI brainwave image pattern, clearly showing that just 10 minutes after meditation, your brainwave pattern, which was completely irregular, became harmonized and uniform within 10 minutes only. So meditation is a software tool to modify the software of the brain. Drugs are chemicals. They definitely, we use drugs like antidepressants, antipsychotics. They alter the chemical milieu of the brain, but they are very crude ways of doing that. We know how complicated a network of neurons the brain is. So dealing with it in a very crude way is by drugs. Meditation is software dealing with another software. And it is now known that it is very effective. These are some of the bestsellers. You may probably be known or be aware that how neuroplasticity is being now understood. And meditation is a very powerful tool for neuroplasticity. As I discussed about smoking, because of neuroplasticity, meditation is able to mold our habits, help us change our habits easily. Similarly, we are utilizing meditation and its relaxation effect for helping people with intractable pains. Some cancer patients, so much of pain, and nothing was helping except meditation practice, which reduces the pain, produces calmness, gives them a sense of relief. Anger management, these are, we do commonly workshops in corporates, and it is now a buzzword in corporate world, amygdala hijack. And it is now known that how when you meditate regularly, your amygdala shrinks. Amygdala hijack does not happen. You do not react in a way which is self-destructive. You are able to pause for a while and then give a very good response. And this is possible only by regular meditation when your brain circuits get modified and you are able to bypass amygdala. So this was a study we did in my earlier institute at Max when I was working there. We did this study in collaboration with IIT Delhi, and we invited heartfulness meditation practitioners to our echo lab, and we used to study one subject in a day. Same time, same circumstances, we looked at two practices of heartfulness, meditation and a cleaning practice which heartfulness offers, 30 minutes of these practice, and we compared it with a baseline 30-minute interval when the subject was sitting quietly with closed eyes. And we compared these three arms and we demonstrated that when you meditated or did cleaning, there was an immediate change in your sympathetic dominance, which shifted to your parasympathetic dominance. And we analyzed this based on the Holter monitoring, which we had given to them for a continuous 1.5 hours. They were hooked onto a Holter monitor and we measured their heart rate variability. So we demonstrated that just by meditation, they were able to switch from a sympathetic dominant tone to a parasympathetic dominant tone. Heart rate variability change occurred. Similar change occurred with cleaning. The basal heart rate went down continuously and blood pressure also reduced significantly. And this was a one of its kind, very good quality study published in the Indian Heart Journal, premier cardiology journal of the country. And that is why it was very popular in the media also. First of its kind study talking of coming together of spirituality and science. First time in the country we were able to bring that meditation practice in a respectable manner and be discussed in a scientific community that this is in fact a very scientific tool demonstrating clearly the effect of these practices on the heart. And India Today ran a cover issue on the science of meditation. First time in our country, we had a popular magazine talking of the science of meditation. So when we presented this research paper at the World Symposium at AIMS Rishikesh, which was held in March 2019, and people from across the world had participated. Different meditation practices and their impact on cardiovascular health was discussed. There were poster presentations, oral paper presentations, and our paper on heartfulness meditation and its effect on happiness and cardiovascular health won the first prize for best research paper from more than 400 papers which were published here and demonstrated here. This was such a powerful demonstration of direct effect of these practices on cardiovascular health. So it is not surprising that we are getting these evidences now, because for thousands of years, the word that our Sanskrit language used for health was swasthya. Swasthya, if you do Sandhi Vichhed, it translates into swa and sthya, which means swa means self and sthya means sthir. One who's centered within himself is swasth, means healthy. So you are healthy when you are centered within yourself. And self resides nothing else, nowhere else but in the depths of our hearts. We all know that. When we ask even a child to point towards himself or herself, the child points towards his or her heart and not towards the brain or kidneys or liver. So our self resides in our heart. And if we are centered within ourselves, within our hearts, the deepest core of ourselves, then we are in a state of perfect balance, which is the state of health as defined by our scriptures, and which is now being talked about as holistic health, physical health, mental health, spiritual health. So all this comes naturally if we inculcate meditation and if we are able to remain in that centered state all along, in that meditative state all along throughout the day, then no wonder our lifestyle will be better. We are unlikely to indulge in harmful habits like smoking, indulge in drinking indiscriminately, and regulating our lifestyle in a disciplined way. So this is how I think meditation will help us regulate our lifestyles, help us lead balanced life, disease-free lives, and more productive lives. So I invite you all for a short experience of meditation if we have time today. And I'll show you how we can connect to the Heartfulness Institute. It's a free of cost, widely available, easy to practice system, as I mentioned. As a start, we can all download this app on our phones, available on App Store as well as Google Play Store, the Heartfulness app. And you can be further guided. You can connect to a trainer, take introductory sessions, and start this practice. See it for yourself in a very scientific way. Take it as a very critical analysis. Do this practice as they tell you to do. Not more than 1 hour in a day maximum you will be requiring to incorporate the 3 practices that Heartfulness offers. Observe for a few weeks what is happening to you. Are you observing any changes in yourself in a very scientific way? And then continue to practice or reject the practice. So that is my invitation to all of you. So please try this practice. And if you are yourself convinced, then you will be able to discuss this with your patients. You will help them feel better. You can share this practice with your patients and promote this practice as a tool towards well-being, of course, at no cost. So thank you very much. And thank you once again, Dr. Ranjan, for the kind invitation.